Hello, today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water absorbent, and the mid layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19.
And welcome to another question and answer session with WHO. Today we're going to be talking about masks. I know it's a topic that a lot of people are very interested in. WHO updated its guidance on masks on Friday, so that's why we're talking about this today. I have with me today Dr. Benedetta Allegranzi. She's WHO's technical lead on infection prevention and control. Thank you for being with us, Dr. Allegranzi.
Thank you.
And my name is Nika Alexander. I'm a communications officer here in the media relations team at WHO. So first off the top, I said that WHO just updated its guidance. Can you summarize what that new guidance is, or what has changed in our guidance since the previous guidance, which went out on the 6th of April?
Okay, thank you for the question. So first of all, we update our guidance as evidence emerges, and so the evidence informed some changes that are related to the use of masks by health workers, in particular in areas of widespread transmission of COVID-19, the advice of WHO to wear masks, surgical or medical masks, continuously in clinical areas, in healthcare facilities. Second is really to give more practical instructions for wearing a mask by the public, by the general public, which we gave advice on already in the previous version, but this time we give many more practical examples. And the third very important element is that based on research that WHO requested, we now have information about the ideal features of a fabric mask, which is the type of mask that is to be worn by the general public in specific situations. So these are the key 3 areas of update.
So that's a lot of information, and we will go into it in a bit more detail. So that's why we're having this session, and we'll be taking questions from you. So the way to ask us questions, for those of you who are on, well, we're live on Facebook, on Twitter, on TikTok, on LinkedIn, and on YouTube. So that's how you can watch. If you have questions on Facebook, LinkedIn, and TikTok, leave your questions in the comment section. And if you're on Twitter, use hashtag AskWHO. Those of you who followed us before know the routine, because this is how we always do these Q&As. So you mentioned off the top that there's guidance for healthcare workers, but also the general public. And I think we'll focus more on the general public in the session today. But if you're a healthcare worker, feel free to ask questions as well. The other detail I wanted to make clear is the WHO guidance it's written for policymakers, for people who run healthcare institutions and so on. It's kind of big, it's 16 pages long. At the moment it's in English, it's being translated into the other UN languages as well, because we know it's something that many people want to see. It's not really written for members of the general public, and so it may seem a bit confusing. So that's why we also have other products that explain it more clearly. So if you look on Twitter and Facebook, you'll see infographics, the video that started the session as well. So that's where you should get some more detailed information for what we might suggest that the public do. So you mentioned off the top that there's new research on the type of fabrics that should be used in a fabric face covering. Can you explain how we got that new research and what that research tells us?
Yes. So first of all, the first point is really what is this mask for? So the mask to be worn by the general public usually is to protect others. What it means is that the mask constitutes a barrier. If anyone is sick, or especially not yet knowing to be sick, because sick individuals should wear medical masks instead, but anyone in the public wearing, in specific situations we can talk about later, a fabric mask to protect others from spreading to them droplets that can be infectious. So this is the function of the mask. So to be able to provide this barrier, these researchers helped us understand what are the features of the mask. And in summary, ideally, these fabric masks should be 3 layers, ideally made of different types of material. The inner part should be something absorbent, so ideally cotton. The medium level, the mid-level should be filtering, so usually polypropylene has been seen to be the ideal. And the outer layer should be hydro-repellent, fluid repellent, potentially or possibly. And one of the materials providing this function is polyester. So the shape is also very important. So it should be able to cover nose, mouth, and chin. And these are the main features that were identified by this research.
So that's actually a lot of information, a lot of detail. We're very specific. You spoke about polypropylene for the external layer, for example, and WHO actually asked some research institutions to look into what fabrics work best. Can you tell us a little bit about that research?
Yeah, so this research is research that looks at the capacity of filtration and also the breathability, so the ability of someone wearing the mask to breathe well. So there are specific laboratory tests and research that needs to be done to assess if the filtration is sufficient, and also the breathability. Also to test, if necessary, the fluid repellent feature of the mask. So by doing this research, we have been able to identify what are these ideal materials to be used and the number of layers to achieve sufficient barrier capacity of the mask.
Building on what you said there, you spoke about the importance of the distancing. So masks are part of a whole set of tools that are important, and we'll touch on that again. But Grace Kolf is asking, if social distancing is maintained, do you still need to wear a mask?
This is a very important question and point of our guidance. In fact, for the general public, really, this is a key principle. So when the physical distancing of at least 1 meter can be maintained, in principle, it's not necessary to wear a mask in the general public. So in fact, our examples are very much around the possibility to maintain the physical distancing, being in enclosed settings where maybe the ventilation is not ideal, and also all of these indications to wear a mask in the general public depend on the local level of transmission of the infection in the area or in the country. So when there is widespread transmission, meaning that there are many people infected, these are the areas where consideration should be given to wearing a mask in the general public, especially when the distancing is not possible to be maintained.
So that's one of the questions around which there's a little bit of confusion, and people asking, how do I know if there's widespread transmission in my community? How do I know when to make that decision? What does WHO say to that?
Well, it is very important to be informed about the local policies because in fact what we give through our guidance document is advice to the policymakers, to the decision makers who need to identify what are the rules to be applied locally. And this very much depends on, of course, the level of transmission, but also cultural aspects, access to the masks, availability of the masks, specific populations. So, for instance, I didn't mention so far, but one of the advices that is very important is that vulnerable people in the population should especially wear a mask, and in their case, preferably the mask should be a medical mask. So there are people who are more at risk for having severe manifestation of the disease and also potential worse outcome of the disease. These are especially elderly people or people with underlying conditions such as lung and heart diseases, diabetes, immunosuppression. So these people within the general population, while being healthy in terms of not having the disease, they still should wear a mask to be protected.
So that's a lot of detail. And we're probably going to talk for half an hour today, try to explain the entire guidance. I know some people are frustrated and they say, why is it so complicated? Why don't you just say everyone should wear a mask?
So, first of all, it's very important to know that anything that WHO recommends should be based on evidence. So evidence that a specific intervention, such as wearing a mask, is effective because it requires a lot of efforts by individuals, but also the whole society. So for this particular intervention of a widespread wearing a mask in the general public, there is unfortunately no evidence that it's useful. So this is a first reason. And then there are also many practical implications because there are costs involved, availability of these masks involved, and eventually there is also another factor, which is that wearing a mask can also have some disadvantages and can also lead to adverse events in terms of some discomfort and also other problems. So there are many reasons why it is much better to wear a mask when it's needed according to specific principles, which means when there is more risk. So this is why WHO adopted this approach, which, by the way, is adopted by many countries. So
it's a risk-based, it's what we call a risk-based
a
approach.
risk-based approach.
And the guidance is a little bit long because it's very detailed on what those risks are, when you're in a risky situation and when it's less risky situation. Let me pull some of your questions sent to me by my colleagues. So we have a Facebook question from Momina Masood, who asks, which masks are best for healthcare workers on the front line?
Yes. Thank you, Momina, for this question. In general, health workers at the front line, in particular those who provide care to COVID patients, these health workers should wear a medical mask in most situations, unless they work in a setting where certain procedures which determine production of aerosols, where the virus could be and could really transmit at longer distances, or there is more risk, then in those situations a respirator which has higher filtration capacity should be worn instead of the medical mask.
So there's a detailed guidance on that as well.
Of
we
course.
have other products explaining when to choose what kind of
Which
mask
type of mask
for health workers as well as for the general public.
Yeah.
A question here on Twitter asking about the use of masks. Would it be possible to use different masks alternately throughout the day so that the virus dies on one while you're using the other one, and then to switch? I think that's what the question's getting at.
Yeah, well, first of all, the point about mask in the general public is that in general we say one mask per day maximum, and usually these masks are washable, and indeed one of the features that is important is to make sure that these materials and fabric can support high temperatures, because they should be washed with hot water. Then changing the mask can be possibly justified, but again, I want to emphasize that the point of a mask, a fabric mask in the general public, is really to prevent someone who is infected and doesn't know it spreads the virus to others. And so I don't see too much the point of changing the mask in this case.
So to summarize then, our guidance is to get one mask per day.
Yeah, ideally, and it should be washed
At the end of
least
the day.
every day, or even more frequently, and in that case it should be changed if it gets damp or dirty, soiled, and these are the most important situations in which you should even change it and wash it more frequently.
If you're wearing one mask through the day, though, so you're taking it off, following the guidance that we're seeing behind us, so that you don't infect yourself or others when you take it off, then what do you do with your mask if you take it off to eat and so on?
Yeah. So ideally, it should be folded carefully and put in a plastic bag, really, and close it. So it shouldn't be put on surfaces or in your bag and so on, because this determines the risk of contaminating these surfaces, and so this is certainly not positive.
And then the importance of hand washing as well, right? Before you touch
Absolutely.
your mask,
So
after.
well, in managing a mask, hand hygiene is absolutely important. So before wearing the mask and after removing the mask, always perform hand hygiene. But hand hygiene is a milestone measure for combating this virus. So as you said initially, the use of a mask is only one element that alone will never protect yourself. Within a strategy, a package of interventions which include especially the physical distancing, the hand hygiene frequently performed, and also the cough etiquette that are the key measures to be undertaken by everyone in everyday life.
So wearing a mask doesn't mean you stop washing your hands,
Absolutely.
looking to keep distance as often as possible,
Absolutely
and cover your cough and sneeze when you can.
Absolutely.
So there's a few questions that I think you've already answered. There's a question from Rinzing Bhutia on Facebook asking for how long is it safe to wear a surgical mask? Is it the same as a face mask? It's one day?
No.
No? Oh, there you go.
No, for surgical mask, we say continuously, maximum 6 hours. So this is the time on average we talk about. But again, the medical mask should be removed in different situations, especially when we are talking about you wearing a medical mask throughout your shift, which is the new guidance WHO provided in this update. We don't mean wearing the same mask throughout an entire shift, especially if it's more than 6 hours. And also the mask should be removed when you are eating, when you're drinking, or when the mask is used for other reasons, for preventing other type of pathogens. In those cases, after this specific use, it should always be changed.
What would be the other pathogens? You mean if they're preparing a medical product, or what would be another pathogen?
There are patients who have other pathogens which require droplet precautions, and in that case, the health worker should change the mask.
Masks. Okay. Question from LinkedIn. For older people, for children, for people who have difficulty breathing, that are already frail and can't breathe properly, but still need to go out to farms and markets, how do you manage the thickness of the mask?
This is a very difficult question. I think, as I said, you need to find a balance between the ideal type of mask, as I explained earlier. Thanks to the research, we could establish that, for instance, 3 layers are needed to be the best type of mask. Then, of course, people with these difficulties, first of all, should really limit the use of masks to the real situation when they are needed. And second, for sure, if still a 3 layers mask determines difficulties to these people, they should have lighter types of masks, of course.
So there's a lot of it depends on the individual in the end to make that balance. So there's the government that balances and makes its recommendation to the general population, and then people themselves make their own risk assessment. Yeah. It's not easy, right? It's a complicated issue.
Absolutely.
Question from Facebook that's a little bit related to what we just had. It's from Yashwardhan Singh Tomar, who wants to know, do I need to wear a mask when I go running or when I exercise?
No, actually, you should not wear a mask when you are exercising because it can actually cause difficulty breathing or increase difficulty breathing, and so it is not advised. It's not specified in our guidance, but it's also common sense. The second reason why it's not necessary is because, as you know, WHO and others advise that ideally in this period, exercise should be done in ventilated areas, outdoor possibly. So in these areas, usually really the risk is very limited.
Because you can have the social distance.
You can have the social distance, and also the ventilation is much better, and so the virus spread is limited.
So that's assuming that, Yashvardhan, you're outside and you're running, and you don't recommend that if you're inside, say you're inside and you're weightlifting and someone's with you, you're weightlifting together and you're not socially distanced, would you wear a mask then, or would you say actually you probably shouldn't be doing that exercise?
You shouldn't be doing that exercise.
And the exercise is still important at this
point. But okay, but in fact, I think that indeed decision makers should take measures to regulate, for instance, the use of of the gyms in a way that the distance can be maintained, because otherwise it's a risky situation. So
another one about distancing in the end. This is a question on LinkedIn. If I'm in a car, can I use a mask?
Well, if you are in a car in particular, it would be, again, we are talking about areas and countries where there is widespread transmission. It's advisable to use a mask if you are in the car with another person. In any case, even in that situation, you should try to keep the 1 meter distance. So it would be wise that if you are conducting the car, the other person sits behind. And if this other person is not someone in your family, so you are not living with this person, is a friend or someone else, yes, then a mask would be advisable, because the distance is limited and you are in a closed environment. But if you are alone in your car, of course, you don't know. You don't need to wear a mask.
Sometimes I see people out driving their cars with their mask on.
You don't need to wear a mask if you are by yourself in your car.
Thank you. Question on Facebook from Susan Davison. Are you now advising that people over 60 years of age should wear a medical mask in the same situation, or in the situations where physical distancing is difficult?
Yes, of course, we are. Again, I repeat, one, this is in areas and countries where there is widespread transmission, meaning there are many people who are infected. And also, again, this needs to be part of a package, so it's not only the mask, but also hand hygiene, the physical distancing, other hygiene precautions, but especially in crowded places where the distance is difficult to maintain, these people are advised to wear a medical mask in this case, not a cloth mask or a fabric mask.
So this is similar to a question we got before, so I brought these with me. Should I wear a mask if I live in a household with an elderly person or people who have underlying conditions? So it's in the household. How do you decide if you as a caretaker should wear a mask, or you as the rest of the family should wear a mask?
Yeah, so again, common sense. Common sense says that if you are someone who goes out and interacts with others and so on in an area where there is widespread transmission, you may be at risk of being infected, not knowing that you are sick, and potentially you can become a source for your elderly person, your grandmother or your mother or someone else. So the first point in the household is to maintain the distance. Again, really to maintain the distance, and also to, there is another element, which is to apply careful cleaning also of the environment. It's another element which is important these days, because the virus can be transmitted through surfaces. So then, if this distance is not possible to be maintained, the advice is rather that the elderly person wears a medical mask, as it is indicated, as I said earlier, for them when they go out and they go especially to crowded places.
Okay. I mean, you say it's common sense, but then it takes a few minutes to answer. So it is actually quite detailed, right? There's a lot of judgment, a lot of thinking through the situation, analyzing. Just two things I wanted to touch on. You've spoken several times about areas where there's widespread transmission. How do you, as an individual, how do you know if there's widespread transmission in your own community? Is it WHO telling you? How do you know?
Well, WHO provides information and data about every country, level of cases, number of cases, and level of transmission. However, as I said earlier, I think the most important is the information provided by the government and by the local health authorities, informing the public and telling where the virus is more widespread, which are the areas. So, because even within a country, you can have different areas. You can have areas where there is no transmission, and other areas where there is
Some states or
widespread.
provinces where there is, and then
Exactly.
some towns and cities where there isn't, and
Exactly.
so on.
Yeah.
Okay. Just before we're going to talk about children and masks. I know a lot of people are interested in that. We've had a few questions today and earlier as well. But just before, I want to summarize how the virus is transmitted in the simplest way possible, just as a reminder to everybody. Do you want me to do it, or will you do it?
Try.
Okay, I'll try. So basically, the virus is in droplets or saliva or in your nose, in the droplets, the liquids that come from your nose or mouth when you talk, as we are, or if you sneeze or cough, and that makes the droplets fly out, and then they can infect you if they get into your eyes, nose, or mouth, or if the droplets land on a surface and then you touch that surface and touch your eyes, nose, or mouth.
Yeah.
Basically.
And this is absolutely. This is very well described in simple words, and this is the reason why also surfaces are important, and why we say that you should avoid touching your eyes, your face, basically eyes, mouth, and nose, and the mucosa that are involved, and why hand hygiene is so important.
And then the distance is because the reason we are so far apart, normally when you do television, you want people, closer together, but we're far apart because the droplets coming out from my mouth will be pulled down by gravity within that
Exactly.
1 meter between us, or
Yeah.
more than 1 meter.
Yeah.
Distance is better.
Most of the vast majority of these droplets, which might be infected, are a certain weight and dimension, so that, as you said, within 1 meter, more or less, they fall into the floor due to gravity.
Or
Floor
onto
or
a
surfaces.
surface like
Yeah.
a counter or a desk, which is why you need to clean the surfaces. Okay. So we have a question related to children. It's a Facebook question from Max Asare, who asks, at what age can a child wear a mask and for how long? So basically, let's talk about children and masks.
Yeah. So the issue is that for sure the wearing of a mask in a child is much more difficult, in the sense that they tend to touch it, to move it around, so it is not worn in an ideal way very often. So as you may have seen in the videos we have presented, there are specific there is a specific attention to be paid how the mask is worn, positioned, and also avoiding touching it, and so on. So all these precautions are very difficult to be followed by children, and so it can become potentially even a risk if then the children touches surfaces and so on. The second point is that we tend to say that it's not so strictly necessary because, according to various studies, children are much less affected than adults by this disease. So about only around 3% of cases are children. So the risk is lower among children to transmit the disease.
To catch it and to transmit.
And to transmit it. So then there could be also, again, among children, more likely there could be problems, potential problem with breathing, especially if they are very young children. In other cases, there could be more difficulties in communication. So all these reasons lead to the fact that there is less need for them, especially under a certain age, which we didn't establish, but again, it's common sense when a child can be more reliable to use a mask properly.
Is that for the parent to decide when they think their child is an age that can manage?
Yeah, and the type of child and many aspects. If they are wearing a mask, for sure, one other element is really for the parents or whoever is with the child to really supervise this. So there is a need for checks, for supervision of wearing a mask among children. So
In the end, our guidance doesn't speak about children.
no,
This iteration doesn't.
there isn't specific mention to this, and certainly we can cover this given that it's a question that is emerging in different ways through our FAQs, and I hope that this discussion is useful for
As well.
people.
So thank you for mentioning the FAQs. There's a lot of products online, whatever platform you're watching us on. There's other information about the wearing of masks, so have a look there. And over time, they'll be available in other languages as well, not just English. Those products are in the translation process at the moment. There's a few questions on ventilation, actually. Weather and heat and humidity. So, how does heat and humidity affect breathing while wearing a mask? Is there a correlation?
For sure, heat and humidity are conditions that make it much more difficult to wear a mask. So there is, to my knowledge, there are no data or evidence about the fact that this induces necessarily difficulty breathing, but certainly, as we also indicate in our document, heat and settings which are hot and humid climates can affect the ability of people to wear a mask, especially for long periods. So this is known as being a problem.
One of the issues. Is it because of potential irritation and the difficulty breathing as well?
Exactly, these two aspects. Yeah.
So a
And
little
the
bit.
sense of heat as well.
Yes.
Because it increases certainly the heat of the face.
So another question from LinkedIn. If you work in a building with a large number of employees and the air conditioning system is operating, would you recommend that all employees wear a surgical mask or medical mask for prevention control?
No, there is no reason, but the considerations about wearing a mask, and in this case it should be a fabric mask in general, is driven by the issue of the distancing,
So
the possibility to maintain the distancing
As much as possible.
as much as
Try to maintain the
possible.
distancing.
Yeah, and also the type of works that may lead to need for close contact. So these are the situations. So the difficulties maintaining the distancing can be due to the space constraints, but also to the type of work and the need for people in some situations to be close to each other to work. So those are the two elements.
Under that circumstance, we would recommend that governments recommend that people wear fabric face coverings.
Yes.
Okay. We talked a little bit about heat and humidity. What is the side effect of wearing a mask for a long time? You talked a little bit about the difficulty communicating and some other issues as well, but what is a longer term effect of wearing a mask?
Yeah, well, I think more or less we talked about all of them, but with fabric masks, there is very little evidence. We don't know very well. With medical masks, which are the closest to a fabric mask, there can be issues of irritation of the skin around the area. Also, as you said, difficulty breathing, especially in some people. Discomfort and heat, especially in hot and humid climates. These are the main issues. Of course, issues in communication as well, especially if there are needs for clear communication, people may have problems in this. So these are the main issues with a fabric mask, which is likely to be better tolerated than other masks.
So we're going to wrap up in a bit. If you have questions on Twitter, ask them through #AskWHO. If you have questions on LinkedIn, TikTok, or Facebook, leave your questions in the comments. Maybe we'll get to do a couple before we end. Question I've seen earlier and wanted to pass along is so our recommendations around the fabric face coverings suggest there should be 3 layers. What if you already bought yourself a mask and it's 2 layers or 1 layer? Is it a good idea to wear 2 masks at the same time or 3 masks if it's 1 layer? And so
Certainly
on?
not.
No?
No, I don't think that you need to wear more than 1 mask at a time. Yes, I think at the moment people should wear what is available. We hope that by providing these instructions, producers and even people will be able to follow these simple instructions we gave. I can say that a person working with us at WHO has been successful in making a mask with the materials and the layers and the instructions that our guidance gives. So I'm not saying it's absolutely easy and feasible, but it can be done. So we hope that this will influence producers and also everyone wanting to make their own mask to follow our instructions.
For people who might have not been with us at the beginning, can you just summarize again what it is that we recommend those 3 layers should be in an ideal homemade or non-medical mask?
Yes. So 3 layers. The inner layer should be an absorbent type of material. So for instance, cotton. The medium layer should have filtration capacity. So ideally polypropylene is the one that provides the best performance. It has been seen. And the outer layer ideally should be a fluid resistant material. So in this case, polyester is one example. So these are 3 materials that can be found, can be purchased on the market. So these are the ideal types of
3 layers.
layers.
And polypropylene, is there another way of saying polypropylene that's more common?
To be honest, I don't know.
No, so that's one you have to look up. And then also we don't recommend that the mask be made out of a knit.
Stretchy material.
Not a stretchy material. It
Yes.
should be
Yes, because
woven.
if it's so the point is that one feature of the mask, it should be that it adheres to the face as much as possible, while obviously leaving space for breathing. But the stretchy material becomes looser, easier in an easier manner. And also it's more affected by washing at high temperatures, and so it should be avoided possibly.
So you said it was easy, but actually I think it's probably a lot of work. There's a lot of people out there who've been making masks for some time already, and they might have to reconsider what their production process as well. It's something that I've found is very touching actually, is how much people have been making masks for other people. Like you said, one of our colleagues, as soon as she saw the new guidance, she went home and tried to make a prototype as well. So I think hopefully people will see our guidance and be able to work around that. Just a couple of things to highlight before we wrap up. The WHO guidance overall, the document itself is actually for governments, policymakers, and so on. It's not really for the general public. We recommend things to your governments, and then they make the final decision as to what they will recommend for their population based on your needs and your situation in your country. I wanted to summarize as well, if you could summarize as well, we spoke about how masks are part of a whole set of tools. Can you summarize for us one more time what those other important things are that we should do to protect ourselves?
Yeah. Well, for sure, the first one we didn't mention so far, I think, is that if you are sick or you start to have symptoms, especially respiratory symptoms or fever, you should stay home. And if you are interacting with other people, you should wear a medical mask. So this is the first precaution if you are sick. And of course, seek medical care and understanding what you have and what is the best way to treat yourself and to protect others. So this is the first principle. For healthy people in the general public, again, this is part of a package of precautions where pillars are physical distancing of at least 1 meter from each other, and hand hygiene, frequent performance of hand hygiene, either using soap and water or hand sanitizers, alcohol-based and drop products for hand hygiene. Also, other precautions to be adopted are the cough etiquette, so coughing into your elbow, or cover your nose and mouth when you sneeze or cough with a tissue, and then dispose of it safely. So these are the main precautions. The other one I mentioned earlier is avoiding touching your face, your eyes, your nose and mouth, and of course avoiding close contact with people who are not your normal persons you live with.
Sort of inside your bubble. Yeah. It's actually a lot. It's a lot to keep in mind all the time, all day long, in areas where there's transmission. So it can occupy a lot of your brain space, I think.
It does, and it has completely influenced our behavior and our social life. I always, when I realized that I haven't been able to hug my friends or my colleagues for so many months, I feel so sick and so sad, and I think many people are missing these kind of gestures as well. So again, other things that we cannot do for the moment is shaking hands and having hugs with people. So it's restricting our life, and it's very sad, but I think we all want to come out of this situation quickly. So I think that people have been very compliant overall.
Yeah.
So.
Yeah, a real gesture of solidarity. Every time somebody
Absolutely.
doesn't shake your hand and doesn't hug you, it's actually a way of showing their respect and affection for you.
Absolutely.
Yeah.
And let's remember once again that wearing a fabric mask is for protecting others. And so this is why we should, if everybody does it, we protect each other, basically.
Yeah, thank you for that. I'm going to close up in a second, and thank you very much, Dr. Benedetta Allegranzi, our technical lead in infection prevention and control. Thank you for being with us. Now, we always list the countries where the people have been following us. So if you find that boring, you can just tune out now, because there's going to be no other content aside from that.
It would be a long list.
Well, here it is. So
Wow.
Here we go. India, Ghana, Nigeria, Indonesia, Sweden, Germany, UK, Bangladesh, Nepal, Zambia, Italy, India. You're from Italy, right?
Yeah.
USA, Thailand, South Africa, South Korea, Turkey, Liberia. On LinkedIn, we had UK, Nigeria, Brazil, Bangladesh, Greece, India again, Indonesia, Kenya, Serbia. I'll try to mention the ones I haven't before. Tunisia, Switzerland, Sri Lanka, Mozambique, Australia, Spain, Tanzania, Norway, Papua New Guinea, thank you. Pakistan, Nigeria, Turkey, we're almost done. South Africa, Italy again, Saudi Arabia, Sierra Leone, nice to see you, Malaysia, and Iran. So thank you very much for tuning in. My name is Nika Alexander. I'm with the communications team here at WHO, and we've been with Dr. Benedetta Allegranzi, who's the technical lead in infection prevention and control. Go online, see all the materials we have. If we haven't explained things well enough, let us know, and we'll do a better job. Thanks. Bye-bye.
Thank you. Bye.
Medical masks should be worn by health workers and those caring for someone with COVID-19 symptoms, persons aged 60 and over, and anyone with pre-existing medical conditions, as they are at greater risk of developing serious illness, and people who have symptoms suggestive of COVID-19. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged. Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. Now, how do you take off a medical mask? Before touching the mask, once again, ensure that you clean your hands with alcohol-based hand rub or soap and water. Remove the straps from behind the head or ears without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for single use only. Discard the mask immediately, preferably into a closed bin. Clean your hands after touching the mask. Always be aware of the condition of the mask. Replace it if it gets soiled or damp. A mask alone cannot protect you from COVID-19. It must be combined with other measures, including maintaining at least 1 meter distance from each other, washing your hands frequently, and avoid touching your eyes, mouth, and nose while wearing a mask. Stay safe and help prevent the spread of COVID-19.